exploration of psychiatric disorders within the realm of sociology necessitates a profound understanding of mental health, its impacts on individuals, and societal perceptions. One controversial method proposed is the act of feigning psychiatric symptoms, such as hearing voices, to gain a deeper understanding of what mentally ill individuals experience. This approach, however, brings forth a range of ethical, psychological, and sociological questions. In this article, we will delve into the implications of pretending to have psychiatric disorders, the nature of auditory hallucinations, the psychological consequences and ethical considerations, as well as alternative approaches to studying mental health, the perception of pretend mental illness. Do people actually believe you're experiencing symptoms? When individuals pretend to exhibit psychiatric symptoms such as hearing voices, they may be perceived as genuinely experiencing these symptoms. This is because these behaviors can closely mimic those seen in actual psychiatric conditions, leading to potential misunderstandings among observers. Medical professionals and the general public alike might interpret these actions as signs of a real mental health crisis, which can have serious consequences, including unnecessary medical interventions or social ostracization. Feigned symptoms can lead to a cascade of events that might be difficult to control. Once initiated, for instance, individuals may find themselves subjected to psychiatric evaluations, medications, or even involuntary commitments based on the perceived severity of their condition. This can be an emotionally taxing experience and can result in lasting stigma. Furthermore, it can erode trust in actual patients who are genuinely suffering from psychiatric disorders, complicating their treatment and support. Understanding auditory hallucinations. What are the mentally ill really hearing? Auditory hallucinations, commonly experienced by individuals with conditions like schizophrenia, severe depression, or bipolar disorder, involve hearing voices or sounds that are not present in the environment. These hallucinations can be distressing, often consisting of voices that may command, criticize, or converse with the individual. Understanding the nature of these experiences is crucial for empathizing with those affected and developing effective therapeutic interventions. Research into auditory hallucinations has shown that these experiences can be deeply personal and vary widely among individuals. For some, the voices might be benign or even comforting, while for others, they can be hostile and terrifying. Content and tone of the hallucinated voices can significantly impact the individual as emotional and psychological well-being. Additionally, the frequency and intensity of these hallucinations can fluctuate, influenced by factors such as stress, sleep, and medication adherence. Psychological consequences of feigning mental illness. Can pretending manifest a mental illness? Engaging in behaviors associated with mental illness can, in some cases, lead to the manifestation of similar symptoms. This phenomenon is linked to the concept of a self-fulfilling prophecy. The brain's suggestibility reinforces certain behaviors or thought patterns, potentially leading to genuine psychological distress. However, it is not a reliable or ethical method for understanding mental illness, as it can cause significant harm to the individual and undermine the seriousness of actual psychiatric conditions. Studies on the placebo and nocebo effects highlight how powerful the mind can be in shaping physical and psychological experiences. The nocebo effect, in particular, demonstrates that negative expectations can lead to the development of adverse symptoms. Similarly, repeatedly engaging in behaviors that mimic mental illness can create neural pathways that reinforce these behaviors, potentially leading to genuine distress. This underscores the importance of approaching mental health research with care and responsibility. Ethical considerations in sociological research. Is it a good way to research mental illness? Researching mental illness through the act of pretending to have symptoms is fraught with ethical dilemmas. It risks trivializing the experiences of those who genuinely suffer from psychiatric disorders and can perpetuate stigma. Moreover, it can lead to inaccurate or misleading conclusions, as the experiences of someone feigning symptoms are unlikely to truly reflect the complex and nuanced realities of mental illness. Ethical research in sociology must prioritize the well-being and dignity of all individuals involved. This means adopting methods that respect the lived experiences of those with mental illness and ID harm. Pretending to have psychiatric symptoms not only poses risks to the individual engaging in such behavior, but also to the broader community by contributing to misconceptions and biases about mental health. Alternative approaches to understanding mental health to gain meaningful insights into mental health within a sociological framework. Alternative approaches are recommended. Qualitative interviews engaging directly with individuals who have lived experiences of mental illness can provide valuable perspectives and foster empathy. Ethnographic studies immersing oneself in communities or settings where mental health care is provided can offer a comprehensive understanding of the social dynamics and challenges faced by those with psychiatric conditions. Collaboration with mental health professionals working alongside psychologists, psychiatrists, and other mental health experts can ensure that research is grounded in clinical knowledge and ethical practices. Qualitative interviews allow researchers to hear firsthand accounts of what it is like to live with mental illness. These narratives can shed light on the subjective experiences, coping strategies, and social interactions of individuals, offering rich, detailed data that quantitative methods might miss. Ethnographic studies, on the other hand, provide a holistic view of how mental illness is managed within specific cultural or institutional contexts. By observing the daily lives and interactions of individuals in mental health settings, researchers can gain a deeper understanding of the systemic factors that influence mental health care. Conclusion: the study of mental illness within sociology is a vital endeavor that requires thoughtful and ethical approaches. While the idea of pretending to have psychiatric disorders may seem like a direct method to gain understanding, it poses significant risks and ethical concerns. By prioritizing empathy, respect, and rigorous research methodologies, we can better understand the complexities of mental health and contribute to a more informed and compassionate society.